Hi everyone! Happy Monday! It is National Eczema Awareness Month, and so it's time to hop on a live conversation with an expert and chat about this really frustrating condition that I'm seeing more and more in my skincare practice. So I'm just going to have Mia join us. I'm so excited for you all to be here and to chat about eczema today. Get the tunes going while we wait here. Here we go.
Hi.
Hey, there you are. You are.
Am I connected okay here? Beautiful. Okay, likewise, amazing. I feel like every time I've done this in the past, there's always
This is and it's Monday too, so it's just like who knows what's about to happen.
Right.
Well, thanks so much for joining me on this. I was just saying how I'm seeing more and more of eczema cases come into the spa, and so for those of you who are like just tuning in and don't know Mia, like I had been kind of looking for somebody to kind of like chat with me about this, I, being a corneotherapist and a skin therapist myself, like eczema is one of those things where it can be really challenging. The cases can run really deep and there's a lot of different triggers and leading causes. And sometimes you have to kind of peek under the hood to really see what is going on with it. And I'd been kind of seeing your stuff on IG and I was like, oh, I love all of your content. It was so educational. I loved how we have similar values in terms of being anti-diet and things like that. So I was like, I need to hop on a call with this woman and see if she's willing to do a chat with me. So thank you so much for taking the time to hop on.
Likewise, yeah, and I'm excited to make some magic together with you. But yeah, it's super timely. I was, telling you we've been speaking lately that it's been very prevalent lately in my practice too, like both with discovery calls coming through and then even like current and past clients who are having eczema flare. So it's definitely something that's like very top of mind for like me and my clients right now. And yeah, just very timely with it being
and the
awareness month, and just
like this is when things are going to start to flare. So I thought, you know what, good time to discuss eczema before that real winter cold comes, and our poor clients are going to need some support. So that's amazing. So for those of you who don't know Mia, like maybe do you want to introduce yourself? Just give like a couple of sentences on you and what you're all about.
Yeah. And then likewise for my community, I'd love for you to tell everyone who you are and what you're all about. So I'm a certified nutritional practitioner and functional diagnostics nutrition practitioner. Kind of a mouthful just to say that I'm a holistic nutritionist. And I specialize in gut health in my practice. And my whole shtick kind of is that I like to really like peel back the layers, kind of like you were just saying, Christine, and really dive deep with my clients. I love taking a root cause approach to clients' symptoms, imbalances, that kind of thing. So I do a lot of work with nutrition and lifestyle. We do a lot of sort of like investigation work through functional labs and conventional labs and that kind of stuff. So we'll talk about a few of those things today. But yeah, I pretty much specialize in that area and like to go as deep as possible to help my clients come out on the other end feeling amazing.
I love that.
Yeah. You tell my community, tell the people here. What's a corneotherapist?
So I'm a member of the International Association of Corneotherapy. So corneotherapy is just like a fancy term for basically the repair and maintenance of your skin barrier. So a lot of estheticians will do some kind of like invasive treatments, like deeper chemical peels, things like that kind of tend to disrupt the barrier. And our skin is, the first line of defense for our immune system. So we want to make sure that that's like intact and healthy at all times. So as a certified skin therapist, I really help my clients repair their skin barrier and get ahead of their issues, specializing really in eczema, rosacea, and acne. So yeah, I take a really gentle approach with the clients, just, like peeling everything back, like you said, really trying to dive into their lifestyle, how they live, what is going on, and really being like that detective to identify what could be triggering these kind of flare-ups. But yeah, from a topical perspective, you know, you'll find I'm a little unconventional in that, like, I'm not huge on essential oils and all these like popular things and these jade rollers and all this stuff that is really trendy. I really like to keep it simple and focus on things that actually work. So, you know, skincare routines, and I love all things mental health too. I know we're going to get into a little bit of that with eczema, because I think with a lot of conditions, inflammatory conditions, especially with eczema, like looking at what's going on in your mindset is like a big one too, and your vagus nerve and your nervous system. So yeah, so that's a little blurb on me, but exciting. So should we just dive in and talk about like what is eczema? Because there's like eczema, and then we have this big thing called dermatitis, and it's like, you know, maybe I'll just kick it off with saying that, so dermatitis is just this broad term for all eczema types. So eczema is probably the word that you guys all know. Dermatitis is more of the, like, the sciencey word that is kind of thrown around. But interesting, derma is skin and itis is inflammation. So the easiest way to look at it is just, it's an inflammatory condition. There's a bunch of triggers and causes and things, but mainly it's red, kind of patchy skin, rashes, really uncomfortable. Typically there's burning associated with it or itchiness in a lot of cases. What would you add to that?
Yeah, no, I feel like that as far as like summarizing what eczema is, that's great. Yeah, I feel like as far as eczema goes, like we're thinking about inflammation, we're thinking about a compromised skin barrier, which I know is your specialty. So those are things that we'll talk about today. Yeah, there's a number of different like subtypes of eczema, which I don't know if we'll have the time to really like dig into all of those areas today. But for people, I guess like maybe one thing is, have you found, or do you see with eczema clients that, you know, there's specific like patterns in terms of presentations? Like I know for a lot of cases with eczema, like we'll get it in like our elbows and behind our knees. You can get eczema on your scalp. Like, do you notice any specific
Yeah,
patterns
absolutely.
as far as
So when it comes to like atopic dermatitis, so this is like the main form of eczema that you'll see, and either you were kind of born with it as a child or you can get it kind of later in life. This is typically manifested kind of in random areas on the body. Typically we see it most in the creases. So like for me, when I get super bout of stress after things start to calm down, I'll get like a classic patch right here in the right elbow. I don't know what it is, but that's my spot. Other people, it can be, you know, full torso. We've got one beautiful client that's got like a severe case right now that's kind of full torso. We've got the neck, face. It's affecting a lot of different areas. You can also get it in just random patches. So you could get like one patch just right on your cheek or at the back of your ear. So it can be very random in terms of atopic. When it comes to irritant contact dermatitis, this is another one that I see often. Typically this one it's caused by a substance or something that is touching your skin that your skin really doesn't like. And with repeated exposure to that substance, that patch of skin will get much more inflamed and irritated, and you can get kind of that burning sensation, especially when you apply topicals to it. I see that a lot with essential oils right now that are causing that. So it could be just, you know, right now with the skincare industry, even, you know, there's a lot more hyaluronic acid that's in a lot of products, or, you know, essential oils. And when you're starting to layer these things on top of each other, you get kind of like a really high dose of it. And sometimes it's just too much for the barrier, depending on what's going on in your life, what you're currently using, the state of our environment with, you know, seasons dropping that challenges the barrier. And so sometimes the skin can just get inflamed because of that. And then the last one I want to speak to is perioral dermatitis, because this is one that is super frustrating. We see it a lot. Basically, this one, for simplicity's sake, it's basically, I like to say it as like a triangle kind of around bottom of the nose. It can actually climb up to under the eyes, but we really see it around the mouth. And then in more severe cases, it kind of tends to creep up to the cheek area, but always concentrated around the mouth. And it just is kind of like this rashy red. It can itch, it can burn. Sometimes there's no itching or burning actually going on. It's just this like really this rash that you're like, why isn't this going away? And so, yeah, it's awesome getting in control of these conditions, because it makes such a big difference on these people's lives. I mean, even with me, when I had just the one patch, the extreme itch that I had, I'm like, can't imagine if I had that on my face. Or to really feel for my clients that are dealing with it on a broader scale.
Gosh, yeah. And that's where it's like, not only is it the issue of this skin being compromised in and of itself, but I see that with clients too. Like that's where it starts to trickle out into other areas of their life, right? Like it starts to impact their sleep quality, and then it starts to impact their mental health, and it starts to impact their ability to work and show up in relationships and all of these things. So it's not just that it's the cosmetic skin issue, it is, but beyond that, I can definitely see how it's like translating into my clients' lives outside of that.
And like with these, like with eczema or dermatitis just in general, like what are some of the triggers or the causes that you see when you start to look like under the hood and you start to do some of these functional tests and things like that?
Yeah, so no, I know you can touch on like a few things like the essential fatty acid deficiency and like that kind of stuff, and the toxic load and topical irritants. So I'll pass that off to you. But as far as like gut stuff, there's a number of different ways that our gut health, gastrointestinal system can influence skin health and ultimately kind of manifest into things like eczema. I see lots of skin issues traced back to our gut health, from things like eczema to psoriasis to acne to rosacea, the whole thing. But as far as eczema goes, so beyond just like you'll tell us a little bit about essential fatty acid deficiency, but of course digestion, if we're not digesting and absorbing our nutrients as we need to be or ought to be, that can absolutely translate into compromised skin health. Ultimately things like eczema, right? If we're not
really what we're eating, aren't we? What we digest. That we need to that being said, I was like, that's a good way to put it.
Yes. Yeah. Yes, we're not what we eat, we're what we absorb ultimately, right? And assimilate. Like we need to be able to make sure we're accessing and digesting food properly. So that's one thing. Like we want to make sure that our digestion is robust enough, so we're breaking down nutrients that we need to maintain healthy skin. But there's two kind of like big areas that I see as far as gut health contributing to eczema. One of them is called dysbiosis, or an imbalance in the microbiome. This can look like gut infections. This can look like an imbalance between the good and the bad bacteria in our gut microbiome. So for those who might be watching this and aren't aware, we have a collection of microbes in our gut, trillions and trillions and trillions of microbes on our skin, which maybe I'll talk about today, but we have microbiomes all over our body. But our gut microbiome specifically, the majority of it lives in our colon, and the gut microbiome has like a huge influence on many, many areas of our health. And we want it to be like an ecosystem that's in balance. We basically want more of the beneficial good microbes that provide us with a lot of health benefits, and a few of the bad bugs hanging around is okay. But when those bugs kind of grow and proliferate and get out of whack, that's where we can start to see issues arise. And this is where there's a big connect between microbial populations and eczema. So there's certain like types of microbes and species that are known to correlate to eczema. So I see things like H. pylori infections, which are really common in my clinic, that can tie back to eczema. Staphylococcus aureus is a huge one, and we'll see that even topically. I don't know if you've ever had clients come in that have eczema, but then also go on to develop staph infections topically, right? Like there's a huge connection there between staph and eczema. Things like strep, candida as well, fungal issues in the gut can also translate into things like atopic dermatitis and eczema on the skin. So there's definitely a case for like looking deeper, especially in tricky cases where maybe you've tried a lot of the topicals or the nutrition lifestyle stuff and still aren't quite getting anywhere as far as resolving the eczema. That's where I'd probably look to like, is there an infection going on that's driving this? And there's definitely things that can be done to, navigate and address infections and that kind of thing. That's what I do with my clients. And then another big thing that I see is leaky gut or intestinal permeability. That's a big one. I'm sure you see this too with the whole like leaky gut, leaky skin connection. Yeah. So, there's so many different things that can influence leaky gut. Basically, leaky gut is the term that refers to our gut lining, which is one cell thick. It's a barrier between our gastrointestinal tract and the rest of our internal system, the rest of our body. And that lining is one cell thick, and it's very vulnerable to different offenders and things like stress and medications and antigens from our food, infections in the gut. All of these things can alcohol is a huge one. Oh my gosh. That can really break down the integrity of that gut barrier, and it can become leaky over time. And that's where we see a lot of connect between gut health and different skin manifestations. So likewise with eczema, that's like a big one that I see, and that I'm typically looking at with clients that have skin
Things will leak
presentations
out,
like
and then
that,
the
for
skin
sure.
is like on high alert, like inflammation, and that's when you get all that kind of redness, and you see that visibly on the skin, whereas otherwise, you know, just be kind of there, you wouldn't see it like manifest visually. I love that. And so for me, I love using my diagnostic tools. If anyone comes in spa for the skin analyses, it's really fun. So I'll take a look at their skin under my Woods lamp, and that'll kind of give me some clues as to kind of what's going on with the skin. So sometimes if there is like a fungal infection that's presented, it's easy if you think about it this way with eczema, like the skin barrier is down, like those defense systems are down to like 0. So it is very susceptible to catching and picking up other things. And we have naturally, like on our microbiome, we have a little bit of staph, we have a little bit of these other, right? So it's easy for it to kind of invade and sort of take over when it comes to a condition like eczema. So if I see like bright green, you know, under my Woods lamp, you know, that's an indication that we've got like some other fungal infections going on. I also like to look for like a melon color, because that will be an indication that there's an essential fatty acid deficiency going on. So especially if I'm seeing a lot of purple hues going on in the Woods lamp, then I can see, you know, the skin's like is very dehydrated. It's lacking a lot of that water content, which is like most often the case, because that there's no way for that skin to retain its own moisture, and that's when you get that itchy, uncomfortable, even burning sensation in extreme cases, because that barrier defense is so incredibly low. So yeah, it's really nice to be able to kind of take a look at, okay, what else is going on the skin, and how can we, you know, in my case, what topicals can we include and what can we remove, some things that are irritating, and then how can we repair that barrier using some calming topicals, which we can discuss shortly. So yeah, there's a lot of different like causes. I mean, even in my practice, I see a lot of clients who are just used to running on high gear all the time. Like there's no breaks in their calendar. They don't take a day off. You know, they're just kind of running in that that heightened state of their nervous system. And over time, you know, as you know, the nervous system is totally related to the gut. And so, you know, the mind, gut, and skin work on an axis. And so we really got to look at, you know, our emotional health too, and see, okay, like, am I getting enough rest and rejuvenation? Like, is my body going to be able to heal? You know, if I'm running a million miles a minute and I'm not taking time to really rest, then, you know, the skin's not going to be able to heal. So I always look at the emotional health and the state, you know, of the stress. Like I had one client who skin was so inflamed and things like that. And after really diving in, I was like, I think you're doing a lot of things right. I think you really need to get a new job. You know, like your job is killing you. And she got a new job like about a month later, and her skin's improving like crazy. And sometimes it's something like that, just a lifestyle thing, that it's like, the job is causing too much stress. So stress management is really huge. And then of course, when it comes to eczema, especially when it's irritant contact, like sometimes there's just a clear trigger, like your skin does not like that detergent, you know, or you know, you can't use fragrances, your skin's just too sensitive to it. So sometimes there's also just a clear topical or like a fabric. You know, wool can be very irritating, and anything that tends to be scratchy can also really irritate. So, you know, going into the cooler seasons, like, you know, make sure everything's very soft, you know, staying away from like scarves and things that are going to be a little bit scratchy on the skin to prevent that initial irritation.
Amazing. I love the holistic approach you take, you know, beyond just looking at topicals, because I mean, I take a holistic approach with my clients as well, and we know everything's all interconnected and speaking to each other all of the time. So I really, really love to see that. Yeah, that stress piece is just so profound. I'm sure every single one of my clients resonates and relates to that. I'm sure a lot of people tuning in and checking this out, like that nervous system dysregulation piece. It's something I'm chatting with to every single one of my clients. And something I just want to add to that is something I talk to my clients a lot about as far as like the stress piece is like, yes, the mental, the emotional, the psychological stressors are huge, very prevalent. They're probably, as far as like stress goes, the things that influence and impact our systems the most. But a lot of people don't realize that there's also like environmental and chemical and physical stressors, right? So things like inflammation in the body, things like lack of sleep, blood sugar dysregulation, which I know is a big thing you talk about with your clients, is blood sugar, gut infections, again, like all of those things can keep your body in that stress state at a more kind of like internal chemical level. So in terms of thinking about stress, like if you're someone listening to this and you struggle with eczema, yes, definitely navigating, like, is it the job? Do you have financial stress, familial stress, whatever that looks like? But then also, you know, how can you prioritize sleep and blood sugar management and all that kind of stuff that's still going to keep your body in that
Totally.
like heightened fight or
Even
flight
things like, you know, food
state.
preservatives, and if you're eating a ton of packaged foods, it's like there's a ton of additives in there that are just not good for you. So looking to eat more whole foods and things that are, you know, even like pesticides, it's things that we don't realize that are in that we're ingesting, or even in the shower, you know, we're having like, how many personal care products do we use? And these fragrances, these phthalates can really disrupt our hormonal system. So there's a lot of just things that we don't think about that can be really impacting. And how I like to look at it is like the skin is like, it's like a bucket, you know, it's our system, and you can fill in, you know, a little bit of stress and a little bit of fragrances and a little bit of like all these things, and there's going to be like that one thing that tips it over, but it's really this whole you know, everything that's contributing to it. It's how can we remove some of those larger items to really get your skin back to that balance, and in a way where it can repair itself. Because a lot of my clients will say, oh, I'm not fixable, you know, like they'll have that mindset of like, this is so bad. And like I when I hear that, it kind of breaks my heart. I'm like, no, you're fixable. Like that's not it. It's that we have to kind of look at everything that's going on. And you know, we got to get your mind out of the way, and we got to get some of these larger things out, so that, because your body knows how to heal, you know, it's just that how can we put it in that right environment to allow it to do so.
Yeah, amazing. Oh my gosh, that's literally exactly what I said to my clients. Yeah.
So should we spend some time giving everybody some practical tips on just, you know, when you work with me and I, you're going to get like a really personalized deep dive. So these are going to be kind of more general things that we see, but nonetheless, a lot of these are really prevalent and things that we do talk about a lot. So we wanted to share just some tips from both of our ends on what you can kind of do today to try to reduce that inflammation, because that's the whole key, is getting that down, and again, letting that skin and that body heal. So maybe I'll kick us off with an obvious one.
Please do, yes. Also, I realized my headphones disconnected.
Yeah,
so
I can hear you
me. Okay,
totally good. If anyone live can't hear, please
Beautiful.
drop in the comments. But no, you're on my end. So an obvious one that I see with every single eczema client is that essential fatty acid deficiency. So it could be that you're not drinking enough water, enough quality water, because we need to have fluoride, chlorine, like things that are in the tap water. So making sure that you're drinking like filtered water. If you can mineralize it, fantastic. That's even better. But just making sure that you're getting, I always say to clients, like, aim for 3 liters, like go hard, aim high. And the reason I say that is because there's so many diuretics. Like often clients will be taking medications or drinking a cup or 2 of coffee a day, and then they're having wine at night. And it's like, those are all things that are going to keep that free water in the system, and you need that water for the skin cells to function optimally and to be able to repair themselves. But you can drink all the water that you want. If you don't have omega-3s in your system, the cell envelope is not going to form properly. So we want to make sure you're drinking lots of water, good quality water, but that you're also taking omega-3s. And often on the bottle, it'll say like 1,500 milligrams. If you really want to get to like 3,000 and higher, if you have eczema and you've got an essential fatty acid deficiency, I would say ramp up a lot on the omegas. It's going to make a huge difference in being able to give your system that water and that healthy fat that we need to kind of rectify that essential fatty acid deficiency. So that's my first tip. Get hydrated.
Amazing. Yeah. Love it. Beautiful. Hydrated and get your essential fatty acids.
That's a key one. What one is coming top of mind for you?
Yeah, I mean, I think like when we're thinking of eczema, I feel like as far as gut health goes, there's a number of things I can recommend to people here. I think one thing initially I want to think about is just like inflammation and how we can try to mitigate that as much as possible from like a dietary and lifestyle perspective. Can you hear me okay? I'm really self-conscious now about my headphones. Okay. Yeah, okay. I'm like leaning into my phone. I think because I opened my notes on my laptop, so my headphones might have connected to my laptop. Anyways, but inflammation. So there's so much we can do from a nutrition perspective, right, to mitigate that. I'm definitely not the practitioner who likes to demonize foods or recommend restrictive diets or recommend that people like cut out food groups and that kind of thing. But we do know there are food products that tend to be more pro-inflammatory than others. So it's just something I like people to be aware of, to be mindful of and discerning of. You know, especially I feel like people who have really chronic cases of eczema, they're willing to, you know, whether it means, so let me, as far as like pro-inflammatory foods, like we're thinking again about ultra processed foods, right? Like things that are highly refined, packaged. Not all packaged food is ultra processed. I think there's discernment that needs to be made between processed foods and what that actually means versus ultra processed foods. So it's just, you know, it's the highly refined carbohydrates, the highly processed stuff that's, you know, not made with whole foods, like that kind of thing.
Oil, like canola oil and high like sunflower oils and high fructose corn syrup. Like some of these sugars are, they're in, like if it's in a package, you gotta look at the ingredients. You want to look for less. You want to look for, you know, you don't want to see a lot of these hydrogenated oils and all of these different sugars because that's going to be pro-inflammatory for sure.
Yeah, exactly. And that's where it's like, you know, I still eat some of that stuff, you know, it's, yeah, which is totally fine. But I think it's, yeah, just being aware that like those foods can promote inflammation in the body, that eczema is, you know, a condition that is highly related to increased inflammation in the system. So it might just be something to consider trying to minimize your intake of those foods. You know, and then on the contrary, I like to focus more on like what nourishing stuff can we add more in. Like I like for clients to focus more on like, let's focus on the stuff we add in versus all the stuff we have to remove. You know, and just like you were saying earlier, Christine, like an emphasis on whole foods, an emphasis on colorful foods. So like really dark colored produce and stuff. Those are the foods that have a lot of antioxidants in it, which is so important for combating oxidative stress, so important for our skin health. Foods with lots of healthy fat, so your fish, your avocados, your coconut oils, nuts and seeds, like that kind of stuff.
Can you make the difference between like the whole prebiotic, postbiotic, and there's one prebiotic, postbiotic, maybe there's another one. Like, because, you know, like a lot of people will say, okay, I have eczema, like I should be taking a prebiotic. And it's like, usually I recommend that to clients, you know, after a bout of, you know, medication, say, something like that. But I know having those three components are really important. Like, can you speak to that and like the role of fermented foods?
Yeah. So aside from like trying to be mindful of inflammation in the system, of course, trying our best to support like a healthy, robust microbiome is very important because that also helps to keep our gut lining in a much better state. So taking care of our gut microbiome is great for, I mean, so many things as far as our system's concerned. Literally, yeah. Yeah, so prebiotics are constituents. Different types of fibers are prebiotic, different polyphenols in foods are prebiotic. And what prebiotics are and what it means is that they feed the microbes in our gut microbiome. So they're the food source that feeds the bacteria and the different microbes in the gut microbiome. So we want to make sure that we're feeding and consuming enough prebiotics on a daily, weekly, monthly basis to feed and like take care and
just like
love on our
like
microbiome.
And like high fiber foods then?
High fiber foods, the easiest way to get prebiotics in, I feel like for people to just like keep it top of mind, is the most diversity you can get in plant foods specifically, the better for your microbiome. So different types of fibers will feed different microbial populations in the gut and help them to grow and proliferate. Polyphenols are now shown to be prebiotic. So these are different constituents like, another easy way to remember getting polyphenols in is eating the rainbow, eating really colorful foods. It's often the constituents in the food that give them their color that are the polyphenols.
Red peppers and broccoli,
like
getting
berries and dark leafy greens, and go for red cabbage and red onion and that kind of stuff. That's a good surefire way to just like whenever you're grocery shopping, like get a bunch of different plant foods in, so your veggies, your fruit, your beans, your legumes, your whole grains, your nuts, your seeds. Getting more diversity is going to feed different populations in the gut microbiome and keep it healthy and resilient.
When we add variety to our food. How does that?
Right?
Like eating healthy doesn't have to be boring.
Exactly.
Have to add that. A lot of people will think like, oh, I gotta eat clean, but then like it's so boring. It's like, no, when you add like the rainbow to your plate, it's so fun and like it's visually awesome to look at. But then when you're eating that, there's so many flavors and things. So okay, so that's prebiotics, and then postbiotics is the next one. What's the next one?
So the next one is probiotics. So probiotics are the actual microbes themselves. So this is where fermented foods kind of like have their time to shine. Fermented foods are touted for their probiotic population. So these
like
foods,
live culture, I guess, right? Food. Like that's what sauerkrauts, fermented pickles, kind of thing.
Yeah. Anything fermented, exactly. So it's like they have like natural populations due to the fermentation process in them. So hypothetically, we're getting exposed to those microbial populations through consuming those foods. There are some concerns with that, I suppose. I don't know if it's like, if concern is the right word, but a lot of people question whether consuming fermented foods, if we have robust enough stomach acid, a lot of people are question whether those microbes we're consuming actually make their way through our acidic stomach environment down into the microbiome. I think as far as I'm aware, I haven't looked at the research in a little while, but I think fermented dairy products, so like kefir, yogurts, like that kind of stuff, there have been studies to show that those microbes do translocate and kind of make their way and influence our gut microbiome. But yeah, like getting in fermented foods kind of increases your exposure to beneficial microbes. Fermented foods also tend to be, the actual fermentation process can make different vitamins and minerals and nutrients more bioavailable in those foods. So having like sauerkraut and kimchi and kefir and yogurt and like all that kind of stuff, they're very like nutrient rich foods, and very high in fiber and polyphenols and stuff on top of their microbial populations. But yeah, I mean, like we have a microbiome, we have probiotics that live in our gut microbiome. So ideally, for me, it's more important in most cases that people are consuming prebiotics to feed their existing microbiome. I tend to use probiotics in like supplement form, in very like strategic cases with clients in clinic. But I do think fermented foods, if you can tolerate them, are a great addition to like your daily nutrition. Like 1 to 2 tablespoons of some sort of ferment a day is amazing. Some people who have like histamine intolerance or histamine issues might not tolerate fermented foods, so that's something to consider. But yeah, those are a great addition. And then postbiotics. So it's kind of like there's prebiotics that feed the microbes, and then the microbes, they ferment those prebiotics, they eat them, they process them, and then they create byproducts as a result of that process, which are the postbiotics. And there's a number of different postbiotics that are produced by microbes in the gut, and those are very, very beneficial for us. So there's different things like propionate and acetate and butyrate, short chain fatty acids that provide us with health benefits. One of the biggest ones is that they keep our gut lining healthy. So the more we can feed the beneficial microbes in the gut microbiome, they produce more butyrate for us, those postbiotics, it keeps our gut lining nice and healthy. So like all good things as far as
love that. Oh, that's really cool. Okay, so yeah, just really, I mean, it sounds like you could almost go pretty simplistic with it, like just to not dumb it down, but bring it down for people. It's like just eat the rainbow, eat that variety, and then
eat the rainbow,
feed your own probiotic microbes, and then that will give you the postbiotic. So just focusing on that initial kind of rainbow will help you get there.
Yeah. Rainbow diversity, I feel like as like blanket statements, whole foods, like those are some really simple, straightforward ways to just like have like overall support your GI health. People who have different infections or imbalances in the gut microbiome might find that like fermented foods bother them, or increasing fiber really bothers them. So that's kind of like an aside, but just something to think about if you maybe struggle with eczema and you go and try to increase your diversity in plant foods and stuff. If you're finding it's exacerbating issues or causing more symptoms, it might be time to like dive deeper into what's happening in the microbiome.
Love that.
Just like an FYI, but yeah.
I can talk about topically reducing inflammation. The first step is really to remove what is a potential irritant. So there's things that are gonna irritate, you know, if the skin barrier is disrupted, there's just obvious ones. Anything with fragrance, whether it's synthetic or whether it's natural, isn't going to be a good idea. Especially essential oils, looking at, you know, because the molecular structure is so small, it really penetrates really deep into the skin and even into the bloodstream. So it really does go deep. And anything that goes that deep is going to have more of an irritating potential. So even things like that are active, like acids, obviously stay away from that. Even things like vitamin C can be very active on the skin, and you want to make sure the barrier is very strong and healthy before you were to incorporate something like a vitamin C. So you really want to pair back to an extremely simple routine. Even with a lot of my eczema clients, we don't even cleanse the skin. Like, we just let that barrier build back up, and instead we will apply like a calming mist. While that skin's damp, we'll apply a hydrating serum, 1 or 2 ingredients, something very simple, you know, with ingredients like cassia seed or a little bit of hyaluronic acid under 1%, you know, things like allantoin, something very calming. So a mist, a hydrating serum, and then we want to put on some emollients on top. So a moisturizer that's going to lock that in, because with eczema prone skin, you know, you're not going to produce enough of that that acid mantle and that layer on top that's going to keep things in. So you want to get a bit of a heavier cream, things like arnica, stem cells. Those are going to be great ingredients that are going to help to heal the skin. And then often with eczema clients, especially this time of year, it's looking at balm. So it's really inclusive. That's actually going to trap that into the skin for a period of time while you sleep. It's not going to evaporate on you and give you that itch overnight that's going to keep you up and ultimately keep you from sleeping, which is how we're really going to reduce inflammation, is getting that restful sleep. So I would say a really great evening routine would be winding down, you know, say 8 p.m. or something like that, really starting to wind down, getting your salt lamps on, dimming the lights, gentle movement if you want, reading a book, whatever it may be. Taking an oat bath is a great one. You want to make sure you're not having hot water. Hot water is going to be another irritant. So sticking to kind of like a lukewarm, warm kind of setting for the skin and doing that evening routine, getting that topical skincare on to kind of quench the skin of like its thirst, is going to really be helpful in just giving you some of that relief. So that's one that you can immediately do. And if you want to pop those products in the fridge and use them cold, like that's going to feel really, really good. So there's some things like that you can do to reduce inflammation, like in the moment when you're feeling itchy. It's like cold therapy is a great way to go.
Beautiful. Amazing. Oh yeah, I feel like that, like, I mean, yes, healing topically from the skin, but also like the symptom management, right? If just like making sure you can like just calm things down so you can get a good night's sleep, that's gonna like improve the healing cycle and expedite the healing
absolutely.
so much faster.
And I do want to touch on the emotional piece, because this is a piece of eczema I feel like is really underlooked. And a lot of clients that come to me like, I don't know, I've never had this, and I randomly got eczema, and I'm like, what's happened in the last 6 months, you know, in your life? Like, did you get a new job? Did you go through a breakup? Like, did somebody pass? You know, like often there is something emotionally that had happened in the client's life. And I think if you're not sure what it is, you know, journaling is really a great way to figure it out, because you can freeload, get everything out of your head onto your mind, and really see factually, like, okay, what has happened in that timeline. Sometimes it takes the skin a little bit of time to kind of catch up. If you're running on high all the time and you're finally calming down from that sometimes when things can start to flare up. So it's not even looking at what happened this week. It's like, what happened the last couple of months, you know, in my life? Where was I stressed out? What was a big event that had happened? And journaling out and getting it out of your head and onto paper can be a great way to get a good night's sleep so you're not ruminating on it. Obviously therapy is awesome, huge big therapy fan. So speaking to somebody about what's going on and helping kind of you navigate those things in life are great. I do some cognitive behavioral therapy with clients, that resetting their mindset, because if you've got that mindset of like, something is wrong with me and I need to fix myself, like that is not going to be helpful for you as you enter your skincare journey. We need to go in with, I am healing and my body knows how to heal, and I'm going to give my my system the best possible, you know, environment to allow that healing. Like that's the kind of mindset we need to go in with. So looking at what thoughts are going on, and sometimes, you know, we get 60,000 thoughts a day coming up, and a lot of these, 80% of them are the exact same thought from the day before, and 90% of them are negative. So it's really difficult actually for us to change that mindset and get into a positive state. So writing it down and getting it on your journal will allow you to see like, oh wow, like start highlighting like that's a terrible thought, that's terrible. And then we can kind of work at, you know, reframing these and saying, how can we actually, you know, look at the situation in a better light, or give you a new belief or a new thought that's going to help you move forward in the situation, and not, you know, you think that thought and you immediately get depressed or anxious or overwhelmed, whatever your response is to that thought. But what you think is really going to determine how you feel. And if you're constantly feeling down and low and stressed and anxious, you know, that is totally contributing to these flare-ups, because it is really all connected. So I think from an emotional standpoint, it's a really easy thing to start is get that journal out and start recognizing what thoughts you are having, and then work with a qualified practitioner if you need to on reframing these thoughts, or you know, doing some CBT to try to look at these limiting beliefs and rewriting those.
Gosh, yeah. And I mean, even if you don't struggle with eczema, if it's anything else as far as your health is concerned, like it's still so prevalent, right? It's huge. It's huge. Yeah. And I think, like, to your point, in my experience so far, anyways, with eczema clients, a lot of people just don't make the connection between our stress system and our mental and emotional state and our thoughts, and how that can translate and contribute and manifest in different health concerns.
Absolutely.
Like eczema,
Absolutely. Right? And something that's coming to mind now is I treated a baby actually for eczema, and we've made some amazing progress, and she ended up having irritant contact because the drool was actually just so acidic, and she had an hand-foot-mouth episode months prior, and so it was just the microbiome was off. It was like total dysbiosis situation. But what was pretty incredible was what we ended up doing was just like increasing like hydration, like internally, working with the pediatrician on things like that. But topically, it was just like actually human stem cells and then a balm to occlude the area, so that when the drool came about, it wasn't irritating the area. So sometimes, like, not that it's a quick fix, because I don't want anyone thinking like, oh, topicals are always a solution. Like there's always more to it, but there's things that you can do to get that relief pretty quickly, like getting those symptoms under control, so that you can move forward, and that you start to believe like, okay, no, I'm not, you know, damaged, like this can work, like my body can heal. So there's actually lots you can do, and often it does come down to that personalized recommendation. Like I could throw out a bunch of different products I've got on the shop or ingredients that'll help, but sometimes it's at looking at like what your skin actually needs, and you know, having a very simple routine to try to get ahead of those symptoms.
Totally. I love that. I use the same approach with my clients when we first get it like started together. I always err clients on the side of you know, not going for that band-aid fix to their problems, but I do think there's a case point for it when we just need to slap a band-aid on it in the meantime to find some relief, to build trust in your body. I find it's very like validating and motivating for people when they're like, okay, I can do this thing and it's getting a bit better. Like, let's continue on this path to like really take the root cause approach. But I definitely think like that's such a beautiful example of like, what can we do for symptom relief now while we're working on like the root cause and
makeup? Like I want to touch on that for a second. People think like, oh, I shouldn't wear makeup and this and that. And it's like, if you're using a really high quality mineral makeup that has ingredients in there to help heal, and there's no talc and all these irritants in it, like out of sight, out of mind can be the best approach, because how traumatizing is it looking at your skin every day when it's patchy and red, and you're going to the grocery store and people are pointing it out at you? Like sometimes it's best if no one's pointing it out and you're staying sync with distance from the mirror, and you have makeup on so that you're not getting triggered every time you see yourself in the mirror. Like that's not something you want to do long term, but as a temporary solution that can really support your mindset in so there's a lot of little things like that can actually make a big difference too.
Amazing. Beautiful. Okay, I want to be mindful of our time here. I know we were like, oh, we'll chat for 30 minutes. I feel like I could talk to you all day. Yeah. Do you want to share a little bit about what we have to offer people?
We
have such a fun
I shared on my
collaboration.
stories a little earlier. I was like, I have a surprise, but you can't wait till so me and I have partnered up on a gut skin rescue bundle. So we want to team up on your eczema cases. So what's the price again? It's $375, I think. Yeah, you get 2 meetings. So you get an initial consult with me, which is my skin analyses. You get your strategy and intake session with Mia. So you get the topical and internal team together so that we can work together on healing your skin. You know, there'll be additional, like if you need additional sessions and additional work with us, we have a process where we can educate you on how that works. But these initial sessions will give you your treatment plan so that you know what you need to do and what steps you need to take. So it's not like you do these sessions like, okay, well, that's it. There can be more that you need to do. However, these initial sessions are really helpful at looking under the hood, figuring out what is going on. As it relates to the gut, functional testing is excluded. Like that would be something you'd have to do additional, but maybe you can speak to even, I know some people have like objections on, okay, well, am I really, if I don't know the testing, like what else can, like what can I actually do to get started? But there's actually quite a bit you can do without even doing the functional testing.
Yeah. And I think like even with, you know, with every single client that I have, even if we are going to run functional lab work together, be it stool testing, mineral testing, hormones, what have you, I'm always starting with my clients on dialing in on their foundations. And, you know, through this collaborative approach, you know, just getting started with clients on like anti-inflammatory nutrition and the lifestyle piece, supporting the nervous system from a nutrition and lifestyle perspective, that blood sugar piece, helping with the implementation and actioning of it all, you know, is something that I can really be of support to you with. Yeah, so like I start with that fundamental foundation, like in that foundational place with every single one of my clients, regardless of whether or not we're running lab work. So it's such a brilliant way to get started with this, and you can really move the needle from that like nutrition and lifestyle,
like healthy habits. And so I think, you know, building out, you know, things for internally, what you can do in lifestyle, and then having those calming topicals and relieving like your symptoms and starting to move the needle on your eczema can just make such a big difference, honestly, in a couple months. So you can start to see some relief pretty quickly. So it does make a big difference. That's why I'm so excited to like launch this and like share it with the community, because I think together, like our clients, they're going to see faster results. They're going to have, you know, a qualified team working together on this, looking at the whole body in such a private, personalized way. So I'm super pumped. If you guys have questions, you can drop them here. You can DM us. You can email us questions about this. We have the link in bio. We developed a landing page so that you can kind of see what it's all about. It's got some details on there. So if you want to hop on to either one of our links in the bio to check that out, you can kind of see some details. But yeah, we're really excited to get started. We already have one client that we're working on together, and we're excited to get some more going. So if you need help, reach out.
Yeah, I can't wait. I've been like seeing, like I was telling you previously, like skin stuff has just been so prevalent lately, and I don't know like what's going around in the air or whatever, but it's coming up a lot, and not just eczema, but acne, you know, collaborative acne and rosacea and all that stuff. But yeah, we'll be sharing in the next little while too, like more about, you know, this offer and what it entails and that kind of stuff. I'll share my stories today as well, just like a link to the.
We worked so hard on it, so. But this was awesome. So yeah, if anyone has questions after watching this with anything, like don't hesitate to leave a comment, you know, on the video, or send us a DM or an email. We're happy to answer any questions. We can even hop on a quick discovery call to answer some questions about, you know, your case and working with us. So yeah, don't hesitate. And thank you so much for hopping on with me too, Mia, and collaborating. I'm so excited for this partnership and helping more people. You know, I think together we'll be a lot stronger too. So very excited.
Likewise. Yeah, no, thank you so much. I think it's like I said, I think a lot of people just aren't aware of like the gut connection and the stress connection, and, like, you know, all this stuff. So it's nice to just chat it out a little bit and hopefully give some people, you know, some tangible places to get started with. I think we yeah, provided some really awesome tools for people to hit the ground running off the back of this. But yeah, definitely go check out our offer. I'm so excited to collaborate with you. It's going to be incredible.
So have a wonderful day, guys, and your week.
Likewise.
Bye.
Bye.